Welcome back to the voice of Medicare for All. That's how I'm going to start branding this program from now on, because I think Medicare for All needs voices speaking out for it. And as I've mentioned on the show a couple times before, I used to work in the healthcare industry. I was a data analyst. I actually ran companies. I understood the field pretty well. I knew underwriting. I was really, by the way, really good at it. And the reason why I was good at it was because, first of all, I didn't fully grasp the implications of what I was doing yet. But secondly, I love working with numbers, and I love the way that people behave and understanding the way people behave. So I was very good at kind of putting two and two together and seeing how different benefit plan designs would affect utilization and things like that. But at the end of the day, what I came to realize, and the real reason I couldn't do it anymore, was I realized this was a kind of inhumane form of social engineering that was being done in order to, and like, I still have friends in that business. It's not that the people there are necessarily evil in their intent, but we all get caught up in our day-to-day lives, right? But what I came to realize was that this was really not a humane way of going about giving people the medical care they need. And I've gone off to this on this slight autobiographical tangent to make a point, which is that we need to now let go of some of the kind of logical constructs that people like I used to be made. And there were a lot of people like me in and are in the political policy world, both Democratic and Republican. We got to get away from that kind of rationalization of an immoral and broken system that people like I used to engage in. For example, we used to argue, and I used to think that somehow competitive forces in the market helped keep healthcare costs down. Now, I just want to read you a statistic from a paper that was published this month in Health Affairs Journal, which is a very good health policy journal that permits a number of point of views to publish there. But this is research. This is not an opinion piece. Okay. The authors of this piece examined the growth in healthcare spending on people with employer-sponsored private insurance from 2007 to 2014. They talk about their data source, which included insurance claims from three of the biggest insurance companies out there. They found that in this study period, which is a 7-year span, private health spending per enrollee grew 16.9%, while growth in Medicare spending per fee-for-service beneficiary decreased 1.2%. In other words, Medicare, the government system, kept prices flat. The private, quote-unquote, competitive, quote-unquote, free market health insurance system costs exploded. They went up by 16.9%. And I should add that costs exploded on a very, very high base to begin with, because the United States has always spent far more per capita on healthcare than every other developed country, even though, unlike those other developed countries, we have a lot of people who don't have any healthcare coverage at all. So, in other words, everything that I believed was absolutely false. Now, there are still people who believe this. Now, the Republicans I consider a lost cause on all of this. I think we just got to get them out of office and get Democrats in control of things. But we need the right kinds of Democrats. For example, we need Democrats who are not House Budget Committee Chairman John Yarmuth, Democrat of Kentucky, because John Yarmuth doesn't get it. He doesn't like the new Medicare for All bill. He says, quote, "I don't consider it Medicare for all. It's universal health care on demand, unlimited. It's all single payer, no private insurance. It's a very different thing than Medicare," end quote. Well, as we learned with Nancy Altman earlier in this hour, of course, Medicare for all is very different than today's Medicare. It's much better for everyone, including seniors. It covers a lot more. Now, why does that make John Yarmuth uncomfortable? I choose not to believe it's because he's a bad person, but because he doesn't understand that all the things that he's uncomfortable doing without, like copays and deductibles, they don't really do any good for the system. They don't save money. We all believe they did. The research that told us that I think is inherently flawed. I think it's time for people to understand that all these things like copays and deductibles actually just keep people from getting the health care they need, and we can afford to give everyone the health care they really do need. So let's go ahead and do that.